The problem is that most parents are looking for a solution, and many of their children who are on the autistic spectrum needs that special care, special hand holding, special attention, and they cannot get the work done if they are awake. Many of them cannot, not all, but many of them cannot. So it's important to find a pediatric dentist, general dentist, whomever, who has access to an anesthesiologist who can help the parent have that kid get their work done.
All right, back with what Dr. Johnson again. Dr. Johnson, you help parents to get their children into the dental chair so they can get dentistry done, actually, when children are a little bit apprehensive from a dentist or have some conditions. And we talked about the many ways you do that already a little bit. Let's for a minute talk about a couple very specific things, such as, for instance, people who have autism. Let's talk about that. Why is it important for the parents to actually search out a doctor who will then, as soon as possible, right away, try to get an anesthetist to the table as well?
Yeah, good question. The problem is that most parents are looking for a solution, and many of their children who are on the autistic spectrum needs that special care, special hand holding, special attention, and they cannot get the work done if they are awake. Many of them cannot, not all, but many of them cannot. So it's important to find a pediatric dentist, general dentist, whomever, who has access to an anesthesiologist who can help the parent have that kid get their work done. And I see, I would say, if I see 20 patients in a week, at least 2 or 3 of them are on the autistic spectrum.
Okay, basically they are apprehensive, or what's
right. So kids that are autistic have different needs. They have different things they like, dislike, and oftentimes what we do is we just chat with the parents to find out exactly, to get a characteristic of their child. They know their child best, and sometimes they like to have certain toys with them at a particular time that they don't like. Some kids don't like a lot of light, so we try to turn on a light, make it quiet. So I always interview the parents first to find out what the child's likes and dislikes are, so we could tailor the experience specifically for them to make it less traumatic. And if we do that, especially talking with parents and caregivers, we're able to best manage how we take care of that child. Sometimes they don't like a lot of people in the room at one time, and we can make adjustments. We make adjustments during recovery, and all of those are things that we do to cater specifically to children with autism, because all of those children need to have care, and we provide very good care to them, especially, like I said, the practitioners I work with. We are experienced in this for a very long time now.
Basically what I understand, so first of all, you are there because you're very experienced in this. You there, person who gives the anesthesia to calm the person down, the child, the young person, for a relatively short time till he is under anesthesia.
Correct.
Wouldn't he be under anesthesia? This anxiety or this exaggerated, for us people, exaggerated dislike of this or that might simply prohibit a half an hour or 1 hour or even longer dental treatment for a child.
Exactly right. Yeah. So it will make a regular dental appointment very difficult and very challenging. So oftentimes anesthesia is what's required, and those discussions are had with the parents way ahead of time. It's well coordinated so that we understand exactly how we manage that particular child, because I don't deal with all the children the same way. Each has their own, like I said, specific likes and dislikes. But once we get them asleep, then it's really smooth sailing from there on and until recovery. We do give special instructions if necessary, and all our children do extremely well. So I just want parents to know that if they're looking for a solution, an anesthesiologist who not only just trained in anesthesia, but can also help walk you through some of the special ways in which we handle your child is a very good option for them.
I can imagine, and tell me whether I'm wrong, that even for a child, not only for an adult, because of the anesthesia, more work can be performed.
Absolutely. It just obviates the need for multiple dental appointments, which can often be traumatic if done without anesthesia. Correct.
Well, all right. Well, thank you very much, Dr. Johnson.
You're welcome.